All right, our discocleoid. So I'm going to refer to a couple parts on the disc side very specifically here. So let me get this disc into the camera. So I'm going to talk about the face, which is the flat side of the disc. So I'm going to roll this a minute. So here's the rounded back of the disc, and the face is, sorry about that, the face is this flat part right here, the flat circle part, okay? All right, so I'm going to refer to the face, I'm going to refer to the top or the front, and I'm going to refer to the sides. Sometimes I also refer to the sides as the edges, but as you can see, there's an edge all the way around, so I don't feel that that's really clear. So I will try to refer to the side of the disc rather than the edges. Okay, so that we have the sides here, right and left, and then we have the front or the top. Okay, now that you know where I'm talking about, I am going to use this disc very specifically here. So I have my disc. I'm going to get a nice, comfortable, ergonomic operator position. I'm going to get a nice, comfortable patient position. I'm going to get a nice fulcrum that's comfortable so that I don't have to move any of those things no matter whether I'm working on my lingual side or my buccal side. I'm just going to get really comfortable here. Once I'm comfortable, I'm going to pick where I want to start. Does not matter where, but I would recommend leaving that marginal ridge for last. Okay? All right. So I'm going to start by using the side of my instrument, of my disc, in a groove. In this case, I'm picking the distal lingual groove first because you can see that most easily in the camera. So I'm going to roll the side of my instrument into so that it meets the groove. And the front of my disc, I'm going to hold this here and I'm going to point with my Explorer or probe, whichever I can grab most easily. So the front of my disc right here is along the side of my oblique ridge. So it's going to smooth that the side of that oblique ridge as I come down. I'm using light pressure. So even though my amalgam is setting up, I'm using light pressure. I could do this on anybody's hand and it would not hurt them. And you can see I am getting material out and it's smoothing up the anatomy, and it is clearing the cable surface margin from any flash. Okay, so let's do that again. Okay, now that's nice and smooth. Now I want to do the other side of this triangular ridge because it only did smoothed from the top of this triangular ridge into the groove. That's all it touched. So now I'm going to roll my discal cleoid the opposite way, put the other side of the disc into my supplemental groove, and come down like this. You can really see in this video, I'm really happy that I have this nice triangular ridge now for my oblique ridge. And all it took was a couple swipes, so I'm going to move on. If it only takes a couple swipes, great. Okay, so now I was like this because I was working on my oblique ridge. Now I'm going to work on my transverse ridge. So I need to roll my instrument again and come down on the other side and focus on my transverse ridge. Oh, this is looking really beautiful in the camera. This is probably the best camera angle I've had. Really happy that you guys get to see this. And I'm really glad that what happened here. So I have this nice flat side, a triangular ridge, this nice flat side and a triangular ridge. It is slightly pointy, we'll talk about that in a minute, and then I have this little bump of amalgam between. You can't even really feel it, but you can see it for sure on the video here. So I'm going to take the front of this disc, and I'm just going to, with little itty bitty swipes, I'm just going to take that out. There we go. Didn't even take hard pressure. Was really fast and easy, so now I can move on. So now I'm going to work on smoothing the mesial side of this transverse ridge. So again, rolling my instrument so that the other side of my discal cleoid is in where this fossa is going to be. It needs to be defined some more, and I can still smooth the rest of my triangular ridge here. What I want you to also notice while I do this is I have some flash here. This is flash. It's not very much, but it's there. I want you to notice that will go away and be gone by the time I'm done with these strokes. Okay, so I'm rolled into the fossa here. The front of my instrument is on that side, marginal ridge, the side of that marginal ridge. Now can you see that that flash is gone, that the cable surface margin looks straighter than it did before? Back it up if you need to, back the video up if you need to. So now we have some really nice anatomy. We have some height here on my oblique ridge. We have some height here on my transverse ridge, and I have some depth to my fossa. So I'm going to work on my fossa now because I like to be methodical. Once I start in a place, I try to go just all the way around the tooth. So I can come down and just put a little bit more pressure into my fossa here. That will work just fine. And then I'm going to start working the buccal, keep my fulcrum the same place, and I'm just going to kind of scoop it out from the buccal side. Remember, it's getting shiny because it's getting hard. Okay, so you can kind of see how that's showing up here. There we go. Looking really nice here. We are. Okay, I think I'm good with that fossa now. Well, maybe there's a little bump of amalgam here. Not a lot though. Notice I'm coming in from the cable surface margin, sliding down rather than touching my triangular ridge here. That's okay too. If I think that this looks great without needing any more smoothing, I don't need to come in from that angle. I can come in directly from the cable surface margin here. Let's see how that looks. Maybe I'm not going to like it. I do see a little bump of an amalgam, but other than that, I like it. So that bump is right here. So I'm just going to come down at a different angle from the cable surface margin on the buccal side. Okay. That's looking good now. There's a shine to it right here that makes it look like there's a bump of amalgam, and that's actually not the case. It just looks like there's a bump there because of the way the light is shining on it. So now let us smooth the rest of our buccal side. So I'm going to pull down in the same way, use the edge the same way I did before, like this. It looks different because the face is no longer toward the amalgam as much as it was. So this angle looks different, but it's the same angle as I used to come down on this lingual side. Just reaching over and pulling now instead of pushing. So this was a push stroke, and this is a pull stroke, but I come into the amalgam every time. I only go one direction in all of these strokes, and that's into the amalgam. And I lift, so I into the amalgam, lift, and bring it back up to the tooth structure and slide down again. Okay, I've done enough here. I'm going to roll my instrument and do some over here. I'm going to roll a little bit more to get into my buccal groove so you can see more of that amalgam turn shiny. You can see that some of my flash came off. If you didn't notice that I had flash, back it up a little bit and look again. And now you can see a triangular ridge and some height even in the video here. I could see it before, but now it's much more obvious. Okay, a little bit of a bump here, so I'm just going to smooth that out. It's going to make it look less, it's going to make it look flatter in the video because there won't be such an obvious height there, but we don't want it to be too high and pointy either. I'm going to try to get some of this off right here. It's kind of been bugging me this whole time. There we go. Okay. All right, let's move on to this last part of the oblique ridge. So again, I was at this angle coming down on the lingual side. I'm going to be at the same angle coming down from the buccal side. Okay. There we go. And because it's shiny, you can see where my instrument was working and where it wasn't. So the shiny side is where I cleared more material away. The dull side is where my instrument has not touched yet. That's okay. It's good for you guys to see that. Okay, I'm going to roll my instrument and come down here on the other side in my stop sign. So the side of my disc is in my stop sign, and the front of it's coming down the side of the triangular ridge. And you should see a dull spot. I can kind of see it already. You should see a dull spot on the very top of that marginal triangular ridge, excuse me. Okay. Yep, you can see that dull spot right here. right? So let's clear a little bit more because it looks kind of bumpy right here. So I'm just going to start a little lower into my fossa and in my stop sign, just to clear that out a little bit more, like so. Okay. Now, you can see some of my lines here on top of that triangular ridge. So with even lighter pressure than before, I'm just going to come down on the top of that triangular ridge, try to smooth that out a little bit more if I can. But I don't want to make it flat if I can help it. So I gotta kind of know how far to go and when I should just call it good. All right, we're going to call that good, and we're going to focus now on my distal lingual cusp and my marginal ridge. So here you can see I have some flash, side of my instrument in my distal lingual groove, front of the instrument going down the side of my distal lingual cusp. Roll again. I'm going to go use my stop sign now, and I'm going to start all the way at the cable surface margin, as you can tell, like so. And this is where that stop sign really gets defined at the cable surface margin, is at this point here. There we go, like so. And I'm going to come down a little bit flatter here just to clear and smooth that distal lingual cusp. There it is. Okay. I'm also going to clear, it's a little bit bumpy right here. The disc is perfect for that. I'm just going to slide down gently from my marginal ridge into the stop sign here. Really short stroke, just to kind of clear out the fossa here and make my marginal ridge more of the same width all the way across, because I don't really want it to be wider in one spot than the other if I can help it. So you can see all my little lines coming down into my fossa. That's pretty normal. It's going to happen when you do this with amalgam. So I'm going to see if I can't smooth that off by coming now at a different angle and coming from buccal to lingual. There we go. Now it doesn't look quite so rough, and we have more consistent width all the way across, although it is still a little wide here. So I'm going to be really careful. I don't want to cause a void, but it should be hard enough that I'm okay to do this as long as I'm gentle. So don't go really hard after this amalgam, even though it's hard amalgam. And I'm trying to stay in front of that cable surface margin as much as possible when I do this. There we go. There. Okay. We're going to call that part good, except for right there. I just want to smooth it out a little bit. I don't like all these lines and grooves in here. So we're just going to... And like you, sometimes you might feel like you could play with this forever and it's never going to be perfect. I kind of feel the same way, so I'm going to make myself move on. We're going to work on our marginal ridge in the next video.